Seated within the protective case of the skull, the brain is the body's control center, a central computer that coordinates, controls, and regulates emotion, behavior, thinking, learning, and communication. It is responsible for basic body functions such as breathing, heart rate, blood pressure, and body temperature. If these functions are not strictly regulated by the brain, the body cannot and will not survive. The brain is composed of two hemispheres, which can be further divided into four lobes: the frontal lobe, the parietal lobe, the temporal lobe, and the occipital lobe. Damage to selective lobes can cause different long-term or short-term effects, such as loss of mobility, loss of memory, or loss of basic body functions. There are two broad categories of brain injuries, which are traumatic brain injuries, known as TBIs, and acquired brain injuries. A concussion is the most common type of traumatic brain injury. It can be caused by direct blows to the head, gunshot wounds, violent shaking of the head, or force from a whiplash-type injury. Both closed and open head injuries can produce a concussion. After a concussion is acquired, a person may or may not experience a brief loss of consciousness. A diffuse axonal brain injury can be caused by shaking or strong rotation of the head. Shaken baby syndrome or rotational forces, such as a car accident, can cause this type of brain injury. A diffuse axonal brain injury can be diagnosed by extensive tearing of nerve tissue throughout the brain. This can cause brain chemicals to be released, causing additional injury. The tearing of the nerve tissue disrupts the brain's regular communication and chemical processes. This disturbance in the brain can produce temporary or permanent widespread brain damage, coma, or death. An acquired brain injury, or an ABI, is brain damage caused by events after birth, rather than as part of a genetic or congenital disorder, such as fetal alcohol syndrome, perinatal illness, or perinatal hypoxia. There are two types of acquired brain injuries. They are known as anoxia brain injuries or hypoxic brain injuries. Anoxia brain injuries occur when the brain does not receive any oxygen. Cells in the brain need oxygen to survive and function. Two types of anoxic brain injuries include an anoxic anoxia and anemic anoxia. An anoxic anoxia brain injury is where no oxygen is supplied to the brain. An anemic anoxia brain injury is where the blood does not carry enough oxygen. Severe anoxic damage may lead to a coma or vegetative state. A hypoxic brain injury results when the brain receives some but not enough oxygen. Hypoxic ischemic brain injury, also called stagnant hypoxia or ischemic insult brain injury, occurs because of a lack of blood flow to the brain because of a critical reduction in blood flow or blood pressure. Mild to moderate hypoxic brain damage may cause headache, confusion, decreased concentration and attention span, mood swings and or personality changes, intermittent loss of consciousness, seizures, or poor coordination. Rarely, there may be a decline in brain function a few days or weeks after the event occurred. This is caused by delayed injury in the brain.